Our massage therapy program is a very comprehensive, integrated program that is 6 full semesters of our very intense curriculum, as well as a lot of hands-on learning. And so within our 3-year program, as well as our accelerated 2-year program, you get a really wonderful foundation of clinical knowledge, the ability to help others in both your assessment and treatment, allowing you to challenge the provincial registration exam so that you can practice in the province of Ontario. Our curriculum is designed to allow for our students to appreciate what it means to be a regulated health professional. And so with that comes autonomy, with that comes the opportunity to help people in healthcare in a very unique way. Now, massage therapists are in demand. I can't even begin to quantify how many potential employers that I have reaching out to me through email, LinkedIn, sometimes just in a Starbucks line trying to access our graduates. We are definitely one of the programs that our community is seeking. Now, we do have flexible career options, so we prepare our graduates to either work independently or owning a clinic, or perhaps you'd like to travel and work in another province, or perhaps on a cruise ship that might appeal to you. During our program, we have extensive hands-on learning opportunities. And so in our program, you have the opportunity to treat clients directly. We have a public clinic, and this is where our second and third year students have the opportunity to assess their clients, and these are real clients within the community, develop a treatment plan, and then execute that treatment plan so that you can help your clients reach their health and wellness goals. Now you'll have the opportunity to treat a variety of conditions, whether it's wellness or perhaps treating chronic conditions. Perhaps you have a client who just had surgery, or perhaps you have a client who has tendonitis or carpal tunnel syndrome, or perhaps you have a client that recently had a motor vehicle accident. We train our students to be able to treat a variety of conditions and patient populations. Upon graduation, as I mentioned, you will be eligible to challenge the registration exam. So in Ontario, our province has massage therapy as a regulated profession, meaning that there is a licensing exam. And so throughout the program, we have a variety of testing opportunities to provide you with that knowledge to prepare you with what those exams are going to feel like, because there's a written and a practical component. Now, upon graduation, you will be ready to work in the variety of areas and settings that I mentioned. You will have the confidence and the skills to be able to work in rehabilitation or perhaps long-term care, or as I mentioned, perhaps you'll work autonomously in your own clinic. Now, we train our students so that they're not just collaborators within the healthcare spectrum. We're training students to be part of a team, an interprofessional team, whether that means that you're working directly with other healthcare professionals, perhaps it's physiotherapy or chiropractic, but we train our graduates to make an impact by being contributors to the healthcare system. We have a research evidence informed curriculum that allows for students to continuously take information and develop clinical reasoning that's in line with trauma informed care. Now, our admission requirements set you up for success because our program is very much a health sciences program. We're heavily focused on sciences like anatomy and physiology so that you can understand what is happening to the body when certain conditions arise. For example, we have our pathophysiology course, and to be able to have success in that course, you need to understand the normal functioning, so the anatomy and physiology of the human body, and then understand what happens when there's deviations or atypical processes that occur within the body. So again, our admission requirements set you up for success so that you know how you can take the courses within the curriculum and to be successful. As I mentioned, we have a variety of settings that you can work in once you are a registered massage therapist, anything from a private clinic to running your own practice. So within our curriculum, you learn business skills and they are specific to the context of massage therapy so that you are set up for success, so that you know how to appropriately charge for your services, so that you know how to handle our complex taxation system, and so that you are also prepared to market yourself appropriately. Now, my colleagues, as well as Natalia, have mentioned our state of the art facility. We have state of the art equipment, meaning that we have equipment that is going to best serve not only our patients or our clients, but also you as a future practitioner. So this is an image here of some of our students, and they're using hydraulic tables, meaning that you don't have to manually raise or lower your table, which preserves your body and ensuring that you have proper biomechanics. Now, the image that we had started had our reception area to our public clinic. So we have a very welcoming reception area for our clients to come in and experience the healthcare. There it is. So that's our reception area, and our clients will come into this area for our public clinic. We are able to serve the community and provide them with a current gap. So, not everyone can access massage therapy, and our program allows for individuals to come in and receive the benefits of massage. So, these are very specialized opportunities for students to provide care to patient populations that we consider special. For example, athletes, we provide a lot of support to not only our own lead athletes here at Conestoga College, but we also have partnerships with other schools to provide their athletes with support. So you have that opportunity to learn about sports massage. We do have specific neurological conditions that we treat. So whether it's stroke or multiple sclerosis, for example, we're able to provide care directly to those patients, as well as providing care for their caregivers who often are neglected. Again, we have very specialized patient populations. So we have long-term care, palliative or end-of-life support. Our seniors care is a very comprehensive part of the curriculum. And then I had previously alluded to trauma-informed care. So being able to provide support and reintroduce positive touch to individuals that may have had unfortunate incidents like assaults.